With fall and winter approaching, it's important to be prepared for flu season. The flu is a viral infection that can affect anyone. However, older adults can be at a higher risk of not only getting the illness, but also developing complications from the flu. Here to share how to prevent the flu and what to do if you get it is Dr. Monica Montoya with Baptist Medical Group. Dr. Montoya, thanks for being here.
Thank you for having me here.
Well, it seems like it's flu season every time we turn around, but we're getting to that point. And so talk a little bit about preparation. Let's start off there.
Well, the main thing to be prepared for the flu is to get the flu shot this year and every year. Was there certain considerations? How do people make that decision, or is that just something everybody needs to do? Everyone over the age of 6 months should be getting the flu shot.
Is there anybody who maybe should not get it?
It's very important to talk to a healthcare professional if you've had a severe allergy to eggs, if you have a history of having a severe allergy to the flu shot before, if you've developed a condition called Guillain-Barré, or if you're currently experiencing any flu-like symptoms and have had a fever, you should really wait until you're feeling better prior to getting the flu shot.
What are some questions that people might ask you if they're trying to decide, should I get this? What do you hear people ask you?
One of the main concerns of a lot of my patients is the theory that the flu shot might give you the flu or cause you to get sick. It really doesn't. The flu shot is composed of an inactivated or killed virus, and what this means is that while it doesn't give you the infection, it helps your body create antibodies to protect you from it once you do get it.
Well, I know that is kind of a common misconception that's out there. How did that get started? I know sometimes people think they got it, but they really already had it, maybe. Is that correct?
Well, after you get the flu shot, sometimes you can get soreness or redness at the site of the injection. Some people also experience what seems to be like flu-like symptoms, such as muscle pain, fatigue, weakness. These are very rare, however, and they usually only last about 1 to 2 days.
So how long does it take before the vaccine is really protecting someone?
You're fully protected from the vaccine after 2 weeks, and that's how long it takes your body to create your antibodies to that virus.
So say somebody has been around somebody with the flu, maybe helping take care of them, then decides they want to get a shot, and then they come down with the flu or start having some symptoms. Could it be something they picked up before they had the vaccine?
Yes.
Okay, and do you find that to be happening quite a bit?
We've seen it happen, yes.
Okay. Well, you mentioned it's a killed virus. Talk a little bit about that again, because I think that's something that concerns people.
What happens when you have a killed virus in your system is that your body recognizes it and creates antibodies to it, so that the next time you get sick with that same virus, it'll be familiar to your immune system and it'll be able to create antibodies to fight it. What that means is that we're not actually injecting a live virus that could potentially cause an infection in your system.
Okay. Well, we talked about older people are more susceptible. Why is that? Why should older people really make sure they are getting this vaccine?
Well, along with being over the age of 65, there's also other conditions that can cause you to be not only more susceptible, but to develop complications from the flu. Some of these are diabetes, heart disease, and conditions that really, as we get older, might be more common. Also, as we get older, our immune system gets a little bit weaker, which also increases the chances of complications. People with chronic lung conditions such as COPD or asthma really get the flu shot, or really any condition that weakens your immune system.
Okay. Well, we also said we were going to cover what to do if you get it. Some people who waited too long. What are some symptoms that would tell someone, this is really a serious flu, it's not just a bug that's going around?
Some of the symptoms are symptoms that would be very similar to a cold, such as coughing or sneezing, having a sore throat. However, when you have the flu, you would also develop muscle pains, fatigue, weakness, and fever. Not everyone develops a fever, especially if your immune system is weaker or you're over the age of 65. So that's why it's very important to really be vigilant about any other symptoms and talk to your healthcare professional. Sometimes you can also develop vomiting or diarrhea, but that's usually more in the younger populations.
Well, if somebody unfortunately does have it, how can they prevent from sharing this with people they work with or live with or whatever?
The virus can be spread through talking, sneezing, or coughing. So if you do have the flu, it's very important to practice proper hand hygiene, always cleaning your hands with soap and water, cleaning your linens, utensils, dishes, making sure that you don't share these with anyone while you're sick. Also, making sure that you stay home for at least 24 hours after you've had a fever, and really covering your mouth when you cough or sneeze.
Good advice for everybody. Well, are there different methods to get the vaccine?
Yes, there are different methods, and talking with your healthcare professional, they'll be able to talk to you about what would be the best option for each individual.
So what are those methods? I know there's the shot that everybody dreads, but there's also an inhaled version?
Intranasal.
Yeah, tell us a little bit about that.
That can be sometimes more effective for younger populations, where it would be more difficult to get the intramuscular shot.
Okay, so I guess we just need to be brave and get the real thing.
Yes.
Okay, was there any last thing you'd like to add to somebody who, wants to make sure that they don't get it?
Well, one thing I did want to add was, for individuals that do think that they have the flu and are experiencing symptoms like what we talked about, it's very important to really talk to your healthcare professional soon, because there are medicines that can be used to treat the flu. These are called antivirals. However, these are only really very effective during the first 1 to 2 days of the illness. And what they will do is that they will make the illness milder and also shorten the course of the disease. It is effective later on, but really it's very important to get that medicine right away if you do get sick with the flu.
That's great advice. Are there other treatment available that if somebody didn't catch it that soon, what about other forms of treatment?
We could still use antivirals. However, they would not be as effective as early on in the treatment. And other things would be what we would call supportive care. So making sure, that we keep all your other illnesses at bay during that time.
Okay, so we need to get the vaccine, be diligent, and talk to our healthcare provider.
Yes.
All right, well, thanks for being here. We appreciate it.
Thank
you. We'll be right back with more coming of age and living a healthy and fulfilling life after 50.